Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are happy to welcome Dr. Deborah Matthew, a renowned physician, educator, speaker, and author focused on restoring health through addressing root causes of disease. Welcome.
Thank you. It's great to be here.
So can you share a little bit with us on your journey into this field of anti-aging medicine?
You know, I was a regular conventional doctor, but I didn't feel good. I was tired all the time. I struggled with my weight. I had this darn belly fat that just would not go away no matter how hard I tried. And I was so irritable all the time. I had no patience with my kids, and then I felt so guilty for always screaming at them for little things. And it was really confusing because nothing in my medical training helped me understand what was happening to me. And the first step in my journey is that I read a book by Suzanne Somers about women's hormones. And, you know, I was really resistant to reading that book because, of course, medical doctors don't want to get their information from celebrities. But when I read that book and I read about the women who were just like me and how much better they felt when they got their hormones balanced, it allowed me to open my mind, and suddenly everything that was happening to me really made sense. And I learned that there was a place I could go to be trained to practice medicine this way, and that was the A4M. And so I did the fellowship, I completely changed everything about how I practice medicine. And once I got my own hormones balanced, I got my energy back, my kids got their mom back, my husband got his wife back, and I got my life back. But I just could not go back to practicing medicine the old way, because writing prescriptions all day long, where most of the time I was just putting a Band-Aid over the symptom, I wasn't really getting to the root cause of the problem, it just didn't feel right anymore.
What were you traditionally trained in?
My original training was as a pediatrician, and I was a pediatrician for 10 years, and I retired from that back in 2006, and I came to the A4M and completely retrained, and so for the last 13 years, I've been practicing full-time anti-aging functional medicine.
Would you consider your practice a concierge practice?
We don't participate in insurance, so it is a cash-based practice, and it's been really, really rewarding.
And how difficult was that to make that transition?
Yeah, it was a little painful because I was really excited. I knew all of this new knowledge now. I had new ways that I could really help my patients to get better, and it was working, and the patients were feeling better. They were losing weight. They were bringing in their friends and family, so we were getting a lot of referrals. But it was difficult because I didn't really know how to run a business, and that's something that they don't train us in medical school, how to do business and marketing and things like that. So I had to learn, and it was a process, but I can say that now I really have a practice that is the way that I had always dreamed of it. I have a great team. We're really able to help people, and doctors can do so much of a better job helping their patients when they're not sort of stuck in survival mode. And so learning the business aspects of things is really important for us too.
So tell us a little bit about your practice and what kind of anti-aging integrative therapies do you incorporate?
So we practice functional integrative medicine. So when people come in, they are typically people who have just a whole range of symptoms. They're tired, they're not sleeping well, they can't lose weight, they're bloated, they're achy, they got the brain fog. They've often already been to their doctor. They've already tried sleeping pills and antidepressants a lot of the time. And either they didn't feel better or they had side effects. They just knew that there could be more. And so we bring them in and we start off with a really nice comprehensive lab assessment to understand what's going on, what are the parts that are working great, what are the things that are not so good. We're looking at hormone levels, we're looking at nutrient markers, we're looking for markers of the gut microbiome and inflammation markers and how well their bodies are able to detoxify. And then we sit down and we go through all of these results to really analyze things and help them put the pieces together to understand what's happening. And then we put them through a whole wellness program where we address all of the factors that we find. We support them with lifestyle measures, bioidentical hormone replacement therapy where that's appropriate. We use nutritional supplements, and we really help people feel like themselves again.
Yeah, I've talked to physicians about that process. It's been called Codiscovery, where you're sitting down and talking with the patient about what's going on. And really the idea is to get their buy-in, really, because you're partnering with them in their health and wellness journey. Talk a little bit about how important it is to have the patient on board in that way.
Yeah, in medical practice, a lot of the time we are just taught to make a diagnosis, prescribe a drug, on to the next patient to the next room. And a lot of times patients are not compliant with our recommendations, and it's very frustrating, but it's because we don't have the buy-in that we need. And so, especially when we're practicing medicine this way, it is so important that we are partnering with our patients, because we can give information, but really it's on them to follow through. And sometimes we're asking them to make changes that can be difficult, changing their diet or taking nutritional supplements and reducing the stress in their life, exercising regularly. So educating people, really helping them to understand what's going on in their body, why is it happening, what can they do, how much better could they feel, what are the rewards at the end of it for them, it really helps. And so we find that because we spend a lot of time in the beginning really helping them to see what their life could be like and celebrating with them that we've got options and we've got hope for them, it really does help them to be successful because they can see why they need to be making the changes that they need to make.
And in that process, do you find that people intuitively know what's going on and know what some of the issues are? They might not be able to articulate it or know how to address it, but kind of intuitively know?
Sometimes people will come and they often think that they've got a hormone problem. They just know they don't feel right. They know they don't feel normal, but they don't quite understand what it is. And that was the case for me. I knew that how I was feeling was not normal, but I really didn't understand what it was. And in my case, I had Hashimoto's, and I was on Synthroid, which is the standard treatment, for 10 years. But I still had all the symptoms of low thyroid function. And I knew that something was wrong, but I really just didn't know what it was. My lab tests were normal, and that's really all that we're trained to do. So a lot of people that come into me know that something is wrong, but sometimes it's hard to put it in words. It's hard to really be able to express what they're feeling, and they've already been to their doctor. There's no disease that they have, there's no diagnosis, there's no label, other than descriptive things like insomnia or fatigue. So people generally do know that they don't feel good, even if they don't exactly know what the underlying problem may be.
Do you find that sharing your personal experience and story with them helps empathetically and helps them understand that you understand what's going on?
I do think that it really helps people to know that as a practitioner, I've experienced the frustration, right. and so I do think it really is important for us to share our stories, because most people who practice medicine this way, we've got a story. There's a reason that we've ended up here, and being open and vulnerable and sharing that with our patients, I really do think is helpful for them to understand that we got it. Even if the story is not exactly the same,
sure.
They kind of know that we understand.
When you transitioned to become an anti-aging medical practitioner, your practice underwent a few structural adjustments as well. Will you describe some of the challenges you faced and how you navigated those?
Yeah. When I started off, I was doing mainly bioidentical hormone replacement therapy, and I was keeping my evaluations fairly focused. And over time, as I learned new things, I added more lab testing and more modalities, and we kind of grew. But it was important for me that I didn't only have training in the medical side of what I was doing. I also went out and I got trained in business management, in marketing, in copywriting, in things that were so far outside of my realm, because it can be very difficult to start a practice, especially a cash practice, it's so fulfilling. I mean, we love the kind of medicine that we practice. I would never want to have to go back to being an employee or being constricted by insurance regulations, but you have to be able to keep the lights on, you have to be able to make payroll, you have to be comfortable talking to people about money, otherwise you can't make this happen and you can't help people. And so as doctors, sometimes we're not that good at reaching out and asking for help, but knowing that there are places where you can go not just to learn the practice of medicine, but also learn how to run your practice. There are all kinds of consultants and companies out there. And so I hired a coaching company who really helped me to learn how to structure my practice, how to treat my employees, and that made all the difference in the world. And our patient outcomes are so much better now because I've got this great team, we've got our systems in our practice, we've got it down. And it really did take some extra help and some extra coaching and learning how to find out where to go. That was really, really helpful for me.
I know bioidentical hormone replacement therapy is a passion of yours. When does it really come into play with your patients?
I use bioidentical hormones where they're appropriate in the right patients relatively early on, because when people feel better, then they are so much more likely to go for a walk and chop up their broccoli and do the things that we want them to do in order to be healthy. So where bioidentical hormones are appropriate, menopausal women or men with low testosterone or whatever the case may be, that's one of the first things that I start with, because people sometimes feel better right away, and it can make such a profound difference in their attitude, their sleep, their energy, their mood, their quality of life. It's one of the things that kind of gives us the biggest boost forward as we're working on all the other factors. And it is really important, though, that we are putting hormones into a healthy body, because when we think about the risks and benefits of any kind of hormone replacement therapy, it's not necessarily just the hormone that's the issue, it's how your body is going to use the hormone. So I really do want to always use bioidentical hormones in a comprehensive program where we're addressing the whole person. We're addressing nutrient markers and detoxification and inflammation and not just giving somebody a prescription and saying, we'll see them back next year. But definitely, out of all the different tools in our toolbox, the bioidentical hormone replacement therapy is just the one thing that transforms lives, that makes people feel so much better so quickly.
Are men a tough sell?
Men are really not such a tough sell once they get into the office. Guys generally don't always love going to the doctor. They kind of don't always like to admit that something is wrong. But once they've shown up at the office, once they've sort of accepted that something's not right, then actually they're pretty easy. They know they just want to feel better, and because we're doing lab testing and we're putting it in front of them and saying, look, here are your numbers, and we're giving them choices, here are the different things that could be done to make you feel better, usually they're pretty good about it, and they do feel so much better, so it's not hard to keep them going. For men, two of the things that I think are the most common things that I see hormonally for men is low testosterone. And so testosterone levels decline gradually with age for men. It's not like women where we kind of crash and burn around menopause, but we are seeing low testosterone in younger and younger men, partly we think because of all the toxins in the environment that inhibit testosterone production, and partly because of chronic stress. So the other really common hormone issue that I see in men is cortisol problems. So because of chronic stress, cortisol levels are either too high or they crash too low, and since that's our main hormone that helps us cope with stress, they just don't feel good. They struggle with their weight, they're fatigued, they're not sleeping well, they're stressed out. It affects relationships, and when we have hormone problems, it doesn't just affect the person, it affects our relationships, it affects our families, it affects our job performance, it affects our self-esteem. It really has wide implications. And so I would say those, though, for men, the testosterone and the cortisol are the two most common hormone problems that we see, and we're seeing it in men from their 20s all the way on up.
Yeah. Do you use a variety of detox protocols in your practice?
Yeah, so When we're trying to help people detoxify, we try to get them to change their nutrition. At least temporarily, we want to get rid of the bad stuff they're putting in their body. We have nutritional supplements that we use to support liver function so that they can gently flush the toxins from their system. And usually what we do is something like a 30-day detox protocol with instructions in the supplements, and a lot of people feel so much better. The brain fog clears, their tummy gets flatter, their skin gets clearer, energy gets better, achy joints get better. I mean, so many things can improve just by really helping with that one thing.
Have you experimented with any of the fasting mimicking protocols or fasting protocols?
We do a lot of intermittent fasting where we have people restrict their eating to a certain window in the day. Usually we recommend eating within an 8-hour window and then fasting for the other 16 hours overnight. And people are really finding that that's doable. It's not so hard, right? You eat your breakfast a little later, so maybe 10 or 11, and then you finish eating your dinner by 6 or 7. It cuts out the evening snacking, and none of us are eating kale at 10 o'clock at night, right, when we're looking in the refrigerator. But there really is a lot of science behind whether it's time-restricted feeding like what I'm talking about, or fasting mimicking diets, or intermittent fasting where you fast for a couple of days a week. The science is really compelling, and so we really have been implementing that more and more in the practice.
You had mentioned the importance of building community among practitioners to promote anti-aging medicine. Will you share an anecdote or personal experience that has demonstrated the inherent value of community amongst medical practitioners?
I'm from Charlotte, North Carolina, and North Carolina, as far as we know, is the only state in the country that has an integrative medical society. And this society was formed because some of the doctors were feeling like they were being picked on by the medical board because they were doing things that were a little bit new and different, so they banded together. And a couple of times in our history, we've been successful at changing the laws in our state in order to protect our right to practice medicine the way that we feel is best for our patients. And because we have this organization, we've been able to go out and look for other doctors who are interested in practicing this way. We can support them and help them and learn that there are places they can go to be trained, like the A4M. And by supporting each other and creating this local community, it really helps us, because otherwise sometimes we end up feeling very isolated, and we're in our office doing our thing, and we're really happy that we're being able to help our patients, but it is a little bit isolating, and we can do so much more together as a community in order to help the health of the country than any one of us can do independently. We can learn from each other, we can support each other, and I learned so much from my colleagues. I learn about conferences and what's going on and new treatments and what's working for them and what they tried and it didn't work, so that I can avoid expensive mistakes. So I really encourage all of us to work to create this sense of community among functional medicine doctors, because I feel really passionately that my goal is to help change the standard of care in medicine so that it moves closer towards this functional medicine approach. And in order to do that, we need more and more doctors who are doing this, because then our patients get better. They go back to the other doctors and say, I lost weight, I'm off my antidepressant, my cholesterol's normal now. The other doctors will be able to see that this is really working, and together we will really be able to make an impact in a way that any one person just wouldn't be able to do on their own.
Yeah, that sounds like a great model. Well, we're glad you're here, and thank you for sharing that with us.
Thank you.